Welcome back to the Nutrimedical Report, and we have Ron Patterson from LUMEN Photon. Ron, want to hear some details of what kind of testimonials you've had. We talked about the science of, I call it infrared life, LIFE therapy, because the force of life is the frequency of molecules vibrating in solution of water. It is the amazing superconductor, informational superconductor that all life is conducted through. That's why when we look at astrobiology, we're looking for the presence of water in distant stars for Earth-like planets. Thus, there's lives that are based on some other element, which is not very likely, to be honest with you. It's most likely that any life-giving planet, going right back to the ancient theories of panspermia, require water. And, of course, infrared light, when you use LUMEN Photon, it stimulates regeneration, detoxification, circulation, informational transfer to cells to activate enzymes. It's just amazing how it can transform your body. And as I say, we use infrared light and the prolight infrared sauna, but I like the targeted therapy with LUMEN Photon because it'll penetrate through an entire foot of tissue. There's no other comparable device. I've heard of devices that are blue light, red light. Come on. You know, there's no proven research on these other type of things. You want infrared light.
Yeah.
And you can use it over acupuncture points.
Yep.
Instead of doing acupuncture, you can use it over the back of the head for migraines. You can use it over the sinuses for getting rid of sinus infections and osteomyelitis. You can use it over the chest for getting rid of calcified arteries in the heart. You can use it over areas where you've had partial blockages of a leg artery because of plaque formation. You can use it over the chest for congestion. You can use it over a carpal tunnel or a post-traumatic like bruise to a muscle. I mean, it's amazing the uses of LUMEN Photon. So tell us more about some of the testimonials you've had and how you can use it.
One of the big, everything begins with inflammation. So that's one of the big deals in the medical world for the last 10, 15 years. And so when we have a lot of inflammation, it drags the entire body's immune system down. And
right.
Our lights have actually been targeted in a medical study to reduce that, and they did a formal study with 3,500 patients. We were not a part of the study. We didn't know the study was being done. It went on for 3 years at Washington University Med School in St. Louis. 3,500 patients. It was a major study, and truly it was done because one of the doctors involved did this study and did not tell us that they paid for the entire study, and it worked as acupuncture. One of these doctors not only had gone to Harvard Med and all that other stuff, but he had taught himself Mandarin so he could go to China and study Chinese medicine. Long story short, by putting it on your low back area where your adrenals are, that's lumbar 1 area, and you use our all-purpose setting, we call it NICO, and over the course of about a couple of years, it takes it a while to bring it all the way down. But if you have a lot of inflammation, overall it reduced, for the 3,500 patients, it averaged almost 90%. 89% was precisely. 89%. So that means that when your body is basically clear of inflammation for the most part, then
right.
Everything else functions more smoothly. You have less problems. It's very good for something like diabetic neuropathy. It's a treatment. This is not a cure. But if you use it if you have wounds and that sort of thing, you use it on a basis.
We're a little sneaky, actually. We don't use the word cure for anything, but we put it into a state of remission we will not claim the word cure, but how about this? When we use the LUMEN Photon along with our supplements, Nutrifos, Neurogen, Omega Supreme, Krill, etc., antioxidants, Nutritrala, we will actually physiologically restore you to a state where not only the symptoms are gone, but the actual cause is gone. So we're not going to say we're curing you, but we're going to say the symptoms are gone because the problem itself is gone. How's that?
Yeah. Tell folks.
It's not covering it up. In other words, it's not like taking an anti-inflammatory.
Which supplement would include the zinc, copper?
Well, you want to take always take our Vitamin Mineral Max Minerals Plus.
There you go. Okay.
But in terms of the neuropathy, we use Nutritrala, Nutrifos, Neurogen, and Omega Supreme Krill, and Omega Cod Liver Liquid. And we use things to gather the free radicals, such as Nutritrala and cell detox glutathione and Regenerex, because neuropathy is not an easy thing to treat. We stop glycation with the fat-soluble thiamine. We have ultrathymine B1 and allithiamine. We have two different types. And and carnosine, and we can reverse the inflammation of the tissues and nerves with cell defense, which is the most absorbable, highest released curcumin in the world. And when you use that along with lumen photon, we reverse the actual cause of neuropathy, whether it's a toxic neuropathy or a diabetic glycated advanced glycosylation end product neuropathy. And you can prove that by doing things like in nerve studies, like, for example, an axon 2 scan with Dr. Jim Hedgecock, if you just Google that, axon 2, which is a threshold test for A delta and C fibers. Or you can do a neuropathy test with a neurologist, which is a less sensitive test, which is a nerve conduction velocity test for both motor and sensory fibers, and you'll see it reverse. The fact is that neuropathic pain, or the same thing inside your brain, if you're getting dysmyelination caused by toxic use of stupid drugs like HMG-CoA reductase inhibitors, you're going to get dysmyelination of nerve fiber tracts, so you disconnect different, just like taking phone lines and snipping the wires. In an older person, no wonder they can't remember things, or they can't coordinate things, or can't see properly, they lose balance because you've disconnected different parts of their cortex. When you use lumen photon combined with the right nutrients, you amplify the healing by about 300%. So if you're over a sore joint and you've applied curcumin cream and MagneSmooth, you've taken Inflamex, Joint Collagen Max, Joint Performance, and Tendon Mender, the joints just start to heal. And then you're taking Cell Defense and Inflamex, it can't help but heal with the energetics added, so now the tissue is immediately alkaline, oxygenated, and the stem cells are transferring information to the stem cells that are in the tissue, the chondrocyte, immature cells, and the tenocytes for tendons and connective tissue, and they start to regenerate the tissue. And if cells are jumping off the freeway of your circulation into the local tissues because there's release of ergothioneine and other marker molecules to tell a tissue to regenerate, the lumen photon amplifies that signal effect tremendously. So I tell people, I got my lumen photon plugged in, I have it rated now, I'm using it right as we're talking. So people say, why? Because I really exercised hard today. So there's parts of my body that are saying, where's the lumen? And after I use the lumen for so many minutes, it's perfectly fine. And I'm ready to kind of go on with the rest of my day and not be worried. So if you've got neck pain, back pain, joint pain, partially torn meniscus, muscle spasm, anything, low back pain. And the other thing is over the lumbar spine, as you mentioned, you can put it over acupoints. It'll lower plasminogen activator inhibitor 1 or C-reactive protein. And by the way, CRP binds to leptin, so if you lower your CRP, you're helping the body reduce insulin resistance and vascular disease, because C-reactive protein is directly correlated with higher vascular disease and insulin and leptin resistance, which causes problems with oxidized plaque. Interesting, eh?
Yeah. So which one of, or you've got an all-around purpose vitamin supplement that would carry what they need for the
No, you have a combination. The one combination I mentioned. Okay. I tell people, it's not one size fits all. You got to take the right combination for a specific problem. Most people have diabetic neuropathy in our culture. Some people toxic if they're working as mechanics around methylethyl ketone, and toxic solvents, or they're firefighters and they've been absorbed through their skin. They have a Scott Air Pack and they've got a thermal suit. They're still absorbing through their skin toxic volatile chemicals from the fire. And that's why firefighters are always covered by their insurance for respiratory and cardiac disease caused by the volatile chemicals. So they should all have, every fire department should all have a lumen photon, but also should all have a Proline infrared sauna to detox the chemicals and the heavy metals that they're in their body from just being firefighters. Every firefighting station should also have a mild hyperbaric oxygen chamber to kind of help that process of turning off the inflammation down. But lumen photon is fantastic for detoxing over the liver, detoxing over the brain, detoxing over the heart that's getting calcified coronary arteries and unstable plaque. Yeah. You can put it over areas also of the body that are stubborn, that don't want to burn off fat. We call it the cellulite issue. And lumen photon will cook up those fat cells and tell them it's time to burn off the fat tissue. So it's got a million uses. If you get one, you don't need to buy any extra pads or whatever. It'll last you for many, many years for you and your family. Get a lumen. You'll love it. That's it. Get a lumen, you'll love it. That's the key word. And we're back, and we're talking to a lady from tomorrow, Karen, in New Zealand, preparing for us some molecules to extend life. Now, it's a strange thing. We're living in a very strange world, a world which is in many ways trying to determinate itself. Stupid public policy regarding Ebola, stupid financial policy regarding money, stupid policy toward war in economies, which are bringing us to the brink of conflict in the Middle East and Ukraine. But at the same time, we're at the edge, like Ray Kurzweil. I don't agree with this transhumanism. I don't want to become a cyborg, but I do want to have the building blocks so I can rebuild my brain tissue, my liver, my kidneys. I can avoid the toxic polypharmacy of the doctors. And by the way, they have an appropriate initial for their name, a Megadoe, or Mordo, multi-drug, or Megadeth, or Magnificent Deity. You can use any of those terms, and they all apply to MDs. And I happen to be an MD, so I can criticize them, just like if you're black, you could say things about black people. That's not a problem. Now, when you supply the building blocks for the body, the reason why the pain goes away is not because you clobbered it with a, fentanyl patch or a long-acting narcotic, like they've developed new ones that are, quote, fiddle-proof, so that the hillbilly hillbilly addicts to OxyContin can't break it or burn it or snuff it. No, it actually makes the pain go away because what? We don't talk about the word cure. We talk about it takes away the problem. You actually fix the connective tissue, you heal the joints, you heal the liver and brain, you heal the peripheral nerves, so the neuropathy starts to heal along with their other supplements and fatty acids. And the reason why the body starts to function better and it doesn't hurt is because, guess what? And I'm not going to use the word cure because I think the word cure has been apprehended by the drug company. So their word cure is we will prevent the moment of death, so you'll be like the undead. But they don't really, and so the word cure to me I think has been twisted in the 20th century and early 21st by the drug company. So I'm going to use the term, we put you into a state of nirvanic compensation. How's that? Where now you no longer hurt because you're actually better and you're actually in compensation. You no longer have pain signals because the problem's gone. You no longer have weak bones because the rebar in your bones is rebuilt with the Collagen Max and Mountain Red Velvet and Tendon Mender. You no longer have a brain that doesn't work because you're not taking stupid drugs that decrease your brain circulation or your myelin sheath. You're actually rebuilding the brain tissue and the myelin. You're rebuilding your liver because you had hepatitis because you took Dr. Deagle's antipathogenics and your liver enzymes and your viral loads dropped to zero. Now you need to rebuild a liver, which, by the way, you can if you take the building blocks. And I like the analogy of the McLaren supercar or the Lamborghini Countach, which means holy cow in Italian. When you want to have a fancy, mechanic flown in from Italy, from Milano, or one of these places where they build these amazing cars, you've got to make certain you have all the parts flown in too. Well, if you fly the parts in, you voted it for Dr. Deagle, and they're coming from New Zealand, your body says, high five, I can rebuild my carpal tunnel. I can actually type again. I can play tennis again. I don't have to go to the surgeon and do a major surgery to my knee and put an artificial knee like I'm a cyborg. I may be able to tack down that connective tissue and heal it, or heal the tendon that's been gradually tearing around my shoulder so I get a partial rotator cuff tear. They did a study a few years ago at all of the major sports in America, and they discovered that 78% of baseball players, basketball players, and football players have, just looking at the shoulder joint, have significant enough tears on MRI scan or MRI arthrography that they would surgically qualify to have a surgical repair. And those are all caused by micro-injuries that are never repaired because they continue to do stuff and take pills that their trainer or their dumb doctor gives them. I call the dino docs, like Sherry Rogers, or I call them the toxic docs. And they don't fix the problem, so eventually the shoulder ruptures and they wonder, how'd that happen? Gronkowski, how do you tear your ACL? Well, maybe you took a DNA gyrase 4 inhibitor that weakened the connective tissues because you destroyed the ability to rebuild cartilage. Maybe you never ate anything that actually, like Mountain Red Velvet, that had the building blocks to rebuild your ACL, even though you built giant muscles. And as a result, you built giant muscles and connective tissue that couldn't take the stress load. It's like taking a rig out on the freeway and you don't realize you don't have air brakes. Not a good thing to do. So, you want to have air brakes, so you want to take Mountain Red Velvet for your body, your brain, your liver. To build a better you, and I tell people it's not just Mountain Red Velvet. We kind of surround it with a few other things, but the center post is let's get those special boxes of parts through to the Italian auto mechanic that we've flown in at very great expense in a private Airstream jet into fix your car in your private garage. Well, it's the same with your body. And a lot of people are surprised. They say, I got insurance. I can see the toxic doc. He'll give me the 12th, 13th, or 14th drug. Yes, but at that point when you cross that line, you won't know you're actually dead. You won't know that you're actually in a daze. You won't know that you're going for a knee replacement, or you've actually got coronary artery spasm, or you're desmyelinating your brain because you're taking so many toxic freaking drugs. You can't realize that your doctor doesn't know, doesn't care, and doesn't have the time because he's running in the gerbil care of healthcare. And it doesn't matter if it's New Zealand, Australia, Canada, Britain, whether it's big government or big insurance carriers, the doctors are all, I call gerbil docs. They're running in the little cage like a little gerbil, you can even hook it up so they can generate light or power. See the gerbil running. And it's funny, but it's true, though. And you got to take responsibility and start off with Mountain Red Velvet.
That's right.
Tell us all about it.
Oh, there's no other product that you can take that has 396 different active ingredients in one capsule. You cannot get those ingredients in any other diet supplement in the world. And that's why, as you say, if you need to start today...
That sounds illegal. That sounds illegal. That you're actually so greedy that you actually won't allow anybody else to compete with you. Because even the other companies that make Mountain Red Velvet use xylazine, so they get exposed to, anesthetics, or they use solvents, or they pull a part of it out and make the one I heard is called Royal Velvet something or other. I'm thinking it's a spray, like an IGF-1. It's like, come on, ding dongs.
It's
ridiculous. It's tampered. It's not the whole product. Yeah.
Exactly. And our boys grow this beautiful product for us. We respect them. They grow it, and we give it to you exactly the way nature intended it to be. It is inside a capsule, 396 active ingredients that you need to start the healing process. And that's exactly what you've talked about. If you want to get on that journey to good health, you have to heal the body. And Mountain Red Deer Velvet can help you on that journey. It's rich with minerals and vitamins and your amino acids. It's packed with collagen. It's packed with your growth factors. So if you decide today is your day that you want to get good health, you don't want those knees to creak anymore. You don't want to feel tired and exhausted. This is your day. Mountain Red Deer Velvet will help you on your journey.
Yeah. I'm going to give a few kind of simple non-invasive tests that can be done to prove it works. Do a quick scan of quantity of EEG for your brain. Do a thermal scan, digital thermography of your body, and there's clinics all over the world, and you'll see your inflammation going away. Not because you've taken anti-inflammatories or steroids or toxic disease-modifying drugs. Do a bioimpedance test. These are all, there's many others, that'll show you actually rebuilding you. Good idea to do it. Do it every day in the repair shop. Welcome back to the Nutrimedical Report. And, of course, people out there, I want to entertain you and make you think of out of the box, because I'm a box agnostic. And I want to start off with, we're talking Tom Strader from MG12, which makes the MAGNESOOTHE, Arnica Montana essential oils, and the amazing minerals from the Dead Sea, which includes 14 minerals not present in the current oceans, but were in the ancient oceans in which life originated. And we're not talking about evolution. I call it evil, evolution. We're talking about, I call punctuated recreation. And recreation is occurring today. Most people don't realize that as you live, you're creating new epigenetic code in your body, which is recorded as messenger RNA and microtubules. The messenger RNA microtubules is actually creating new DNA, which can even affect your germ cell line and pass on to your next generation. A lot of people aren't aware of that. They're not aware of intelligent, punctuated recreation is occurring every day in every species and every animal on Earth. Now, the minerals that make up our body are called star minerals. And some minerals can be created in various classes of stars. When they go supernova, magnesium is actually created in a supernova explosion. And if you don't have magnesium, you cannot trap energy from sunlight and turn it into any of the plant life on Earth. You only have chemobacteria at the bottom of the oceans that use venting from sulfur dioxide and sulfurated compounds. So 99.99999% of the energy in the world actually is energy grabbed by magnesium, pumps the electron to an outer orbital and creates high-energy molecules in the cell that are turned to sugar and carbohydrates, and eventually also to proteins through various processes in the body of the plant. And, of course, the plants are eaten by animals. The animals then convert that to energy, and we go through the food chain and then eventually ended up with the primary predator of planet Earth, none other than humankind, which has both grinding teeth for plants and biting teeth for animals. Now, magnesium is the life mineral. If you don't have magnesium in your cells, there's a 10,000 to 100,000 magnesium ions ratio to 1 calcium ion. And if you don't have adequate magnesium, nothing in your cells works. There's 300 enzymes tied to magnesium, including your stem cells, your glutathione peroxidase, your messenger RNA, the DNA replicase enzymes. Everything requires magnesium, even counter-ion to calcium, because calcium is like a very, very powerful but very dangerous ion to let in your cells, and it's let through ion channels that's kicked back out of the cell, and if the ion channels are damaged in any way, especially by stupid drugs like calcium ion channel blockers, you actually can permanently damage those channels. You're going to end up with serious problems with brain atrophy, decreased IQ, and permanent damage to the ion channels in your heart muscle, your blood vessels, etc., throughout your body. So most people that have chronic pain, myofascial pain, neurological problems, decreased stem cell activation, decreased glutathione peroxidase activity that protects against the most serious free radicals like hydroperoxy radical, they're magnesium deficient. I recently did my tests personally through ordering them through labtestingdirect.com, and I did the cardio-ion panel and the organic acid urine tests, and my magnesium is stellar. But I can tell you, they were saying, oh my gosh, your magnesium is so high. They'd never seen it so high. Well, because I take MAGNESOOTHE, and when I get a deep massage, I take MAGNECHARGE after a shower or bath once or twice a day. I use the MAGNESOAP for washing. That's what I use exclusively for washing is MAGNESOAP. And I take lots of supplements, our magnesium glycinate malate, our magnesium taurate, magnesium potassium citrate. I'm a MAGNESOOTHE maniac, and I can tell you, whatever else you add to your body, whether it's chromium, vanadium, zinc, copper, etc., if you don't have adequate magnesium, nothing works. Now, you can amplify intracellular levels with our indium 49 in the periodic table, which will even increase your magnesium absorption. Indium, 5 drops in the morning at bedtime will massively increase your, but you can't take any food or water or other supplements within 20 minutes of it. So magnesium has a specific electromagnetic signature. That signature literally is the signature of life. So if you look at a Kirlian photograph of someone with, let's say, mineral imbalances or toxins, you're going to see really weird colors. If you're a acupuncturist and you can see in the near-infrared spectra, you're going to actually see weird electromagnetic points through their acupoints. So when you apply the MAGNECHARGE spray, you literally get a tingle or a zap right at those acupoints because the body's trying to neutralize acid tissue in the organs and make the tissues alkaline, which, by the way, magnesium does very quickly. It's the most powerful alkalinizing mineral known in your body. And I can tell you that a great deal of the disease we see in our culture, including hypertension, diabetes, obesity, premature aging, sensitivity to electropollution. I mean, my electropollution sensitivity now has gone away by just really maxing out magnesium. And it took a good, I say 3 or 4 months of really pushing the heck out of my magnesium supplements and topical. But it worked. And I repeated my test on QRMA, and now my electrosensitivity literally is gone. Now, I take a lot, and I can't stop it and say, well, now I'm cured. There's not a cure word. You got to continue taking these measures forever because we live in a toxic world. So, Tom, tell us about your amazing magnesium products, because we have the MAGNECHARGE, MAGNESOAP, MAGNESMOOTH, and magnesium oil, all from the Dead Sea with essential minerals, with other factors that just make them stellar products. And I tell people, unless you're using these, you're kind of crazy, because when we give you lots of other supplements, you need to put the topical, because you're going to get topical absorption of minerals and essential oils that's going to start curing the body from the outside in.
And, the Dr. Deagle, the thing about the magnesium being transdermal, it was the quickest way for me to get the relief from the pain that I had in my lower back from a bulging disc at L3 and L4. And the other issue, too, was I had it down into my sciatica nerve. I was dragging my leg because my muscle was so tight and hard. And I started soaking in the Dead Sea bath salts. I started using the magnesium oil into my lower back and my hips, my buttocks, and my leg. into my neck and shoulders, and I started getting relief. I also was using the magnesium shampoo, the magnesium soap, just like you were saying, and the magnesium cream. My body was starving for magnesium. I had muscle cramps. I had skin, my facial muscles would twitch. My eyelid would twitch.
Well, they discovered if you give supranormal levels of magnesium, this is Dr. Russell Blaylock, you literally cut out 100% of intracerebral edema and spinal gliosis of the cord if you get a spinal contusion from a traumatic accident or traction injury. You cut out 100% of cerebral hypertension, which can cause your brain to collapse with a foramen magnum. If you give high levels of supernormal magnesium after a cardiac arrest or a myocardial infarction where you blocked an artery and you've given the enzyme to block it, and you give supernormal magnesium, we're not talking about normal levels, but supernormal, you reverse the heart muscle damage. If you've got someone exposed to radiation or sunburn, you can put magnesium on the sunburn. I tell people use our curcumin cream, use MAGNESOOTHE or the spray, the MAGNECHARGE, which is one I like. And you can turn off a sunburn or a chemical burn or a thermal burn. You can turn it off. The local cytokines that your body generates, the prostaglandins, leukotrienes, and inflammatory free radicals, they're switched off if you have the right minerals, especially magnesium, but the other 77 minerals, plus the essential oils. You literally turn it off. And people don't know that. They don't realize that it's your response a lot to the stimulus or the trauma that causes the problem, the same way as if you have a traumatic brain injury. If people playing football, for example, because the season's starting, had supernormal levels of magnesium, even though they're genetically predisposed because of a gene polymorphism, the chances of them getting dementia or what I call traumatically induced microglial activation of peroxynitrate and hydroperoxy radical, because you can measure the metabolites in the urine, you'd see it drop to zero. So I would say for the NFL, I could actually monitor their urine organic acids and tell you who's going to get dementia, who's going to get a post-traumatic concussion, and then going to be off the season if they keep on getting their head whacked. I can measure their gene polymorphism to tell you who has a higher risk. But if they blam up the magnesium to the maximum, you take someone who's genetically predisposed and put it into the zone where they're going to be safe. So people don't know that. They're not aware that you have a population, let's say children, that are magnesium depleted, and you zap them with stacked vaccines. Why do you think their brain's not going to go on fire? You put someone through extreme emotional or physical stress and they start to fall apart. It's because when you're under stress or extreme physical activity, you dump magnesium and minerals through your skin and every organ, and it's the stress mineral. If you don't have enough magnesium in your magnesium bank, you're in big trouble. Right?
Yes, sir.
It's a big deal.
You're exactly right. You're hitting every point, Dr. Deagle.
The magnesium is so important. It's almost like you got a bank account, you got credit cards. What's your magnesium account? If you don't have enough, when stress comes, you're moved out of the ability to tolerate stress. The stress mineral is magnesium, this life mineral, and you're going to start falling apart. Free radical surges, tissue disruption, cell phone, the stem cells won't work. Get it today through NutriMedical.com. MagneSmooth, MagneCharge, MagneSoap, magnesium oil. Welcome back to the Nutrimedical Report, and we managed to cover a lot of material in the first hour with Michelle. She's always trying to zip me along to try to give the compressed answer, but in some cases the questions you have are so good and the problem's so complex to require a more complete answer. So I rev it up to Deagle speed, which is 5,000 megahertz. And if you need more details, you can email or call me. There really is no problem that I won't try to attack, because I love puzzles, which is why I'm a puzzle maniac. I started when I was a kid. By the time I was grade 9, you could throw almost any puzzle or code at me and I could figure it out, because I have the never rest gene. And so I want to quote off Joel Skousen's latest report, and he does a really good report, Joel Skousen's report, which is World Affairs Brief. And I don't always agree with everything he says, but he's closer than a lot of people to some of the facts. And one of the things he mentioned here, in particular about his newsletter, which you can go to World Affairs Brief and you can actually upload it yourself, is how big a threat is Ebola. He quoted a doctor and a nurse that went over in a ministry, and they were wearing all the cool biological protection equipment, and they still got infected. You got to look at several different new facts in the Ebola. The first one is that regular Ebola is you can get infected if you're handling bodily fluids, sweat, blood, urine, etc. But if someone's coughing and they're in the terminal phases of the illness and they have a high viral load, yes, you can get infected. These people were wearing protective equipment, but my feeling, and I said this last night on Jeff Rentz's show as a guest, because I'm on every second hour on Thursday evenings, and on the first hour yesterday, Ebola's not easy to get. You have to be pretty darn sloppy. And now, even if you think you're being careful, if you don't have tight-fitting, we call airtight clothes, which means there's a total seal, not just a full-body suit, which can still let air in. There really should be a full, what I call biohazard suit, which is a Class 4 installation suit. We're not just talking about the kind that you see in an infectious ward in a hospital, where you wear gloves and gowns and you have a face shield and so on. That's not what I'm talking about. That's probably what these doctors were wearing when they're in Africa. If you're in what's called biohazard standard level 4, we're not talking about a class 4 installation, which is a negative pressure facility. You need to have a total sealed suit so there's no air exchange with the surrounding room, period. Because if someone's coughing and they're sitting a lot of virus the last week or so before they get really violently ill, have vomiting blood, or blood in their mucus that they're coughing and sneezing and vomiting, you're going to be exposed to possible high enough inoculum to cause a primary infection. So this doctor and nurse is very concerning. It tells me that the change from a 4-day incubation to a 20-day to 21-day indicates that our policy should be the following. Everybody that's coming from a country of origin where Ebola has happened in 2014 should be quarantined for 1 month with serum drawn weekly, and a whole series of other tests that I can recommend, including investigations I'm researching with a scientist in China, in Shanghai, that actually has worked with a company working on the quantitative resonant magnetic analysis that would pick up specific harmonic frequencies of pathogens long before you can actually isolate a virus or get a positive flu test using serology. I think that we need to start being much more aggressive in terms of how people arrive, not just by air flights. We also need to do studies to find out how long the virus persists on surfaces. It's my guess, and it's only a guess, that the virus probably is significantly less than 24 hours, probably more like 10 to 12 hours on a dry surface. So, we have Bruce connected. Welcome back, Bruce. And one of the solutions, by the way, to the Ebola is oxygen. And I was just reading about clinics in Mexico and for cancer. And one of the things that they do in these cancer clinics in Mexico, and I saw one of the facilities they had, was they give hyperbaric oxygen at mild hyperbaric pressures, but they put 100% oxygen mask on the people inside the chamber. I don't think you do that with your chambers, but I suppose they could be rigged up to do that. Is that correct?
Yes, they could put a hood on, of course, under great supervision, because as you know, 100% oxygen is dangerous.
Right, but we're talking about 100% oxygen at 1.3 atmospheres. So
yes.
What we did basically when we had 3 atmospheres oxygen, 100%, we would actually, in our clinic in Denver, we would give people antioxidants, including intravenous melatonin and other factors to actually protect them against free radicals. And I don't think we need I don't think you need 3 atmosphere 100% oxygen to have the biological effect. And I think this is where I want to kind of spin it, because your chambers are the best looking. You've got the only vertical design, the only clear chamber, the best ergonomic, because they're the brightest, the quietest, the lightest, and the coolest. They don't get hot. You have a valve to tell you the pressure. You can turn the walls into speakers. You have a vertical one. You can even wheel somebody into the chamber. So in other words, there's no excuse. You've taken away all the excuses why they don't want to get their hyperbaric therapy. Hyperbaric therapy to me is not something you do 20 sessions. It's something you do for the rest of your life, like saying, I've had a shower this week. I don't need to shower anymore the rest of my life. I don't think that would be valid, but I think the same thing with oxygen. When we have somebody with obstructive sleep apnea, we may validate that they're getting oxygen the rest of their life. If you don't perfuse tissues and you don't get correct hypoxia, microhypoxia, that's what cancer is. Microhypoxia, that's what autoimmune disease, microhypoxia, with cells trying to survive that situation with the presence of stealth pathogens and toxins and switching on and off genes. So even in the cancer clinics in Mexico, hyperbaric oxygen is used along with, Laetrile B17 and all the other things they do, like cancer vaccines, to try to fight cancer. I use it for fighting autoimmune disease, traumatic brain injury, cardiac disease, detoxification, healing and turning off pain, polyneuropathy, stopping infections and osteomyelitis in bone and the perinasal tissues and the sphenopalatine fossa of the sinus cavities, where you could have chronic osteomyelitis from a coronal CT scan. You can see it. So hyperbaric oxygen is just amazing. I mean, there's so many uses. That's why I call it the power of ones: oxygen, NUTRIMEDS, energetic technologies, and stem cells. That's ones. And I'd like you to tell us more about your machines, because they really are pretty amazing in terms of what they can do to help you recover from virtually every health condition. I don't know any health condition, whether it's autism or traumatic brain injury or recovery from chemotherapy or osteomyelitis or diabetic situation. I don't know any health condition that mild hyperbaric oxygen won't help your body heal. I just don't know anything that will not respond positively to mild hyperbaric oxygen added to their supplements, their exercise, their diet, their detoxification protocols. There's nothing like this.
Yes, and we've eliminated the physical causes, ergonomic causes for not wanting to get in the chamber.
Exactly.
And we recently went through negotiations with our factories to get the cost down further with the economic series or E-series chambers to remove that last obstacle. I don't have $20,000 to spend. I don't have $15,000 to spend. We now have a single-person chamber under $4,000, which is unheard of in the industry. And we did that. Why? Because the goal of our company is to get as many hyperbaric chambers into the hands of people who need them as we can.
Yeah, that's really good. And, of course, by the way, people can also do financing as well. The other thing is that even after a couple of years, they'll retain about 70% of their value, so that you can't compare it to even paying to going into a full 3-atmosphere chamber, because I think that the effects of hyperbaric oxygen are threefold. There's enzymatic stimulation of gene induction, there's the anti-inflammatory effect, and there's perfusion effect that increases ATP and NADH that will raise the energetics of the cells and tissues so you can fight and kill pathogens, detox heavy metals and chemicals, and allow stem cell activation. In fact, there's really good research that hyperbaric oxygen, even mild hyperbarics, is a major stem cell stimulant.
Excellent.
Yeah. So that's how it's working. And I tell people, I said, it's not just, quote, anti-aging, it's, do you not want to have a heart bypass? Do you not want to become demented? Do you not want peripheral neuropathy? Do you not want end-organ failure like liver? Because we're now giving antipathogenics to kill off the viral pathogens, say hepatitis B or C. How about let's give you oxygen so that perfused liver now, the stem cells can go in and start to rebuild your liver tissue. And we give you enzymes to prevent scarring so you don't get liver sinusoid blockage of venous backflow to the inferior vena cava, so you don't get pulmonary and gut hypertension and esophageal varices. All of these things are helped by hyperbaric oxygen. Mild hyperbarics you can do at home safely, compressed air. It's amazing. And if you want more information, how do they contact you, Bruce?
612-325-8243.
612-325-8243. Contact me as well if you need any more information, if it'll help your condition. There is no health condition under the sun that's not helped by mild hyperbaric oxygen. Amazing. It's an amazing thing. Every home should have it. Every person that's an athlete, every person in their middle years, anybody with any health conditions, anybody with a child that's disabled, autism, or any other health problem should have mild hyperbaric oxygen. It's affordable more than ever. It's financeable, and it's fantastic. Thank you, Bruce. Stay right there.
You're welcome.
So, Bruce,